Hi friends, in this series of ECG basics, today I will talk about PR segment. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. The PR segment is a flat, usually isoelectric segment between the end of the P wave and the start of the QRS complex, whereas the PR interval was from the beginning of the P wave to the start of the QRS. And PR segment is the distance between the end of the P wave and the start of the QRS complex. PR segment abnormalities, they occur in two main conditions, that is pericarditis and atrial ischemia. In pericarditis, the characteristic changes are PR segment depression, widespread concave or saddle-shaped ST elevation, reciprocal ST depression, and PR elevation in AVR and V1, absence of reciprocal ST depression elsewhere. Note PR segment changes are relative to the baseline found by the TP segment. When we see PR segment, we have to see the TP segment also, and we have to compare that. If there is PR segment depression, then only we can say that there is PR segment depression. In this ECG in lead V5, we can see PR segment depression in V5 due to acute pericarditis, and in AVR we can see PR elevation in AVR due to acute pericarditis. In atrial ischemia, the PR segment elevation or depression in patients with myocardial infarction indicates concomitant atrial ischemia or infarction, and this finding has been associated with poor outcome following the MI, increased risk of development of the atrioventricular block, supraventricular arrhythmias, and cardiac free wall rupture. Lewis criteria for diagnosing the atrial ischemia or infarction include PR elevation more than 0.5 mm in V5 and V6 with reciprocal PR depression in V1 and V2. PR elevation more than 0.5 mm in lead 1 with reciprocal PR depression in lead 2 and 3. PR depression more than 1.5 mm in the precardial leads. PR depression more than 1.2 mm in lead 1, 2 and 3. Abnormal P wave morphology, M-shaped, W-shaped, irregular or notched P waves. These are the minor criteria. In this ECG, there is profound PR segment depression in the inferior leads as shown in the picture A, V with clear cut TP segment and without clear cut TP segment in the picture B. How do we measure the PR depression? Here we can see that just see how we calculate PR segment depression. Normally, one large box is zero point 0.5 millivolt in amplitude, and two large boxes they contribute about 1 millivolt, and we can see the baseline and its the PR segment elevation or depression, and thereafter we have to calculate that. Wherever the art of the medicine is loved, there is also love for or love of humanity. It was said by Hippocrates. With this, I conclude my today's topic. Thank you. Keep learning.